Thank you for having us. We are also taking a lot of very proactive measures to protect the community and to protect our employees. You'll hear quite a bit of the steps the hospital has already taken. I do want to specifically address the ambulance service. Like Chief Thornton said, you may have an ambulance crew show up at your residence and they too will look a little bit different. We proactively last week made some changes to our policies to protect the public and to protect our staff because they are the frontline staff and the situations are often unknown. So don't be surprised if they arrive at your location and they are in a mask, whether it be on the highway or at your house. We've done a lot of work in the last couple of weeks to prepare for what we don't know is what's coming. We can watch the statistics from other areas, learn from their situations, and try to make it a better situation for our entire community.
I'm going to try to update you on what we've accomplished over the past couple of weeks more specifically. And I have to just stick to the highlights because it's amazing what the team at the hospital, both the leadership and staff and the medical staff leadership has been able to accomplish is quite remarkable. So I'll try to hit some of the highlights I think that would be most pertinent to you to hear. So in a situation like this, effective communication is the key. Effective, profuse, constant communication from key stakeholders, whether it's community leaders, medical staff providers, leadership across Athens, but also across our healthcare system and around the state. So starting at the highest level, on the state level, we have been having consistent calls, frequent calls that have been organized through the Alabama Department of Public Health and or the Alabama Hospital Association in an effort to both give out information on most current guidelines, whether it's from CDC or some other reference, and also to take input from hospitals around the state who have needs, whether it's personal protective equipment or just guidance or questions on who needs to be tested, et cetera. It's been very effective, I must say, in getting the most current information out there. You know, a little bit of problem with that is the information changes by the time you write it down. When you hear it 5 minutes later, there's something else. So I'll take the opportunity right now to just talk to the public a little bit about being patient with not just the hospital, but with emergency management, with the fire department, police. This is a difficult situation. And some of the things that we've done at the hospital, limit visitation, et cetera, reduce our elective procedures. I know those impact people's well-being, their ability to see their loved ones in the hospital. Just know that we do these things to try to flatten the curve. You've heard that term before. And just real quickly, why that's important. You know, when you hear about flattening the curve, that's just projecting the number, looking at the number of cases that could and most likely would happen in a given population. And what you want to see, instead of a big spike in positive cases in a community, because we know there is a higher than flu mortality rate with this novel virus because no one has immunity to it. So you want to try to limit contact with other people so you can limit spreading the disease among your friends and neighbors. You also want to limit the exposure of your healthcare providers in the community. So if we can reduce the spike and spread it out over days and weeks instead of having it all occur at one time like you've seen in other municipalities, that will allow us to better respond to the needs of the community over a period of time instead of seeing everybody at once. So I just ask you please to separate and sanitize. I know you've heard it a million times, but really the hospital's efforts and some of the other things I'll mention in just a minute that we do is kind of a last ditch effort, right? Where the battle begins and 90% of it happens is in the community in the realm of public health. And everybody has a role to play in that initiative to limit the spread of this disease. So the next level is our system level. We're fortunate enough to belong in a system, the Huntsville Hospital Health System, and there's roughly 10 facilities across North Alabama that we have begun having a daily call at 11 a.m. to just discuss where we are as a system, some of the statistics, some of the needs and supplies, some of the issues that come up, and just try to get on the same page, try to identify best practice, and share those across the system so that we all don't have to solve the same problems. We just solve them once and do it as a team. And then at the local level, I've worked outside of Alabama. I've worked all over the Southeast in hospitals, and I have to say I've never been so proud of a team as the Athens Limestone Hospital team. Both leadership, staff, medical staff is remarkable. I've been through some pretty significant disaster scenarios, and I can tell you the response here has just been remarkable in what people are willing to do and the time they're willing to spend and the commitment they have to the health of this community. With that, some of the more specifics. 2 weeks ago, we set up what's called Incident Command. And back to the effective communication, the Incident Command gives a structure, as EMA well knows, that allows for the most effective communication of important information and then decision making, and then that gets back out to the people who need to know. So we started that about 2 weeks ago, and we've been meeting daily, either in person or on phone or a combination of both, to manage our incident command process and work through some of the issues. Now, having done that a couple of weeks ago, we were able to set up some processes that have had an effect pretty quickly. One of them is a flu and fever clinic, which if you have not heard, we turned our Waddell Center, which is near the hospital on Fitness Way. I think the address may be Washington Street. And that is open Monday through Friday. I believe the hours are 9 to 4, 8 to 4. And that is a dual effort to accomplish getting anybody who has flu-like symptoms or symptoms maybe related to COVID to come to that one location, keep them out of all of our clinics that stretch across Limestone County, so that those clinics can then see patients who do not have an infectious disease situation like this. So by cohorting them all in one location, we can give them efficient testing and service and allow the other clinics to function and operate effectively. One of the feedbacks that we received from another hospital in the state that has been impacted pretty significantly was that people in the community want to hear information directly from hospitals and medical professionals. So we set up a hotline at the hospital, and that number is 256-262-6188, and we can get you more info about that. But basically, it is not a medical provider giving you advice on how to treat what you're facing. There's general information about COVID and about symptomology, but then also at the end of the call, there's opportunity to talk to a live person if you have any follow-on questions regarding that. That was stood up within less than a week, an entire clinic, and the whole process worked out. In addition to limiting visitation, as I mentioned, we've closed most access points to the hospital to limit people coming in and out unsupervised. And at those two entrances, we now have screening tables. Everyone that comes into the hospital, including employees, are screened for temperature, asked questions, provided hand sanitizer, and then provided some kind of marker that we wear throughout the day that's dated with that day's date, so that we can confirm as we go to the hospital. If we see someone walking around that does not have a band or a sticker on, then we can question them. How did they get in? Why aren't they getting screened? So we're doing all that to keep both our staff safe and keep our patients safe as well. We've done any number of things more than that. It's just too many to go into. But again, I just applaud the hard work, both in the community and the EMA, medical staff. It's truly remarkable how this community has pulled together to respond to this terrible, terrible situation.
Thank you for having me here. I would endorse what Mr. Pryor has said about Athens Limestone Hospital and the preparedness. I congratulate the hospital. These are uncharted territories, and they have improvised and acted quickly and come up with some very practical plans to foresee what could be coming down the pipeline. So far, Athens and Limestone County have done very well. As you know, we've had about 11 cases confirmed so far, but still keep your antennas up, be prepared. This still probably is the lull before the storm, okay? The storm is still headed this way, and we have to not lose our sense of preparedness and become complacent and overconfident. This is very important. We have to continue maintaining social distancing, hygiene precautions. When we cough and sneeze, use the elbow, hand washing for 20 seconds with the proper sanitizer. These are the sort of things we need to continue to practice. In Limestone County, what I'm seeing is there has not been a panic. Everything is proceeding calmly, and that is very important. That is the opposite of having faith. If you have a community that is built on faith, they will not panic easily. They will not do unreasonable things. And that's what we're seeing, and that is very good, and we need to continue with that. On an aside, we talked about somebody mentioned the assisted living facilities. Think about it, assisted living facilities, we have 2 of them in Limestone County, and we have some assisted living facilities and nursing homes. It's almost like a perfect storm for the coronavirus. These are elderly people. They have a number of medical problems, diabetes, heart failure, and what else. And they're all together. So it's like they can spread it to each other, like the example of the cruise ship. And so these are the sort of places we need to protect. And the other day in the paper, Athens News Courier, there was a photograph of somebody visiting through the window. That's what we need to do. We need to show our love. We need to visit with them on video and Facebook and show them our love, but at the same time, try to protect them. That's very important. And then somebody mentioned, in order to prevent panic, we have to make sure we rely on credible sources. Credible sources are very important. Don't go by any little rumor that gets started on social media, because that can spread like wildfire and it can cause a lot of disruption. And then also the fever and flu clinic, that has come along very well. Remember, things will look different, and over there things are practiced in a different way. People will come in their cars and they will be screened while they're in their cars. They should bring some sort of photo identification. They should bring insurance information and have a cell phone with them. So this is the protocol at the fever and flu clinic, and it will be triaged, and then on an as-needed basis, they will be tested for the virus. Not everybody will be tested, and everybody does not need to be tested for healthcare reasons. Now, if you have other reasons, if you're surveying a population, that's different. If a scientific study is being done, yes, you can test more people. But given limited resources and limited number of tests, everybody does not need to be tested. And that's one of the examples of not panicking. There should not be an irrational push in our county insisting on people being tested. Also, Suzanne from the emergency room talked about our preparations over there. From my standpoint, we need to try not to flock to the emergency room. We should not go there unless it's necessary, because the people over there are very precious at this time. Their time is precious, and we need to let them be so they can handle the crisis without trivial distractions. So if something is not serious with us, we should try to find other sources of care, call the personal physician, talk to them on the phone, and see what can be done without having to go to the emergency room. Also, I hear, especially from UAB, there's an appeal that there's a national shortage of blood, so if you're eligible, try to donate blood. That is important. And then finally, the 10 people per gathering restriction is very important, and the 6 feet from each other, that is because of the droplet precautions, and that makes sense. And one more thing, people with mild symptoms, of course, fever, cough, mostly a dry cough, tiredness, fatigue, runny nose, all of these together, not usually one, but the fever is the most important thing. And then you may have diarrhea and nausea. So these are the mild symptoms. This will be 4 out of 5 people. Now, once people have the mild symptoms, going forward, 3 or 4 days later, 5 days later, not in the beginning, but going forward, some of them, maybe 1 out of 5, will get worse. And that's what we have to look for. People who start getting short of breath, complain of chest pain, people who say turn blue, start acting confused. These are usually older people who have other medical problems. That's what we need to look for. Those are the warning signs, and those are the people who probably need to be taken to the emergency room.
Hello. I am indeed the Chief of Staff, represent, I don't know how many, multiple doctors of different specialties at Athens Limestone. And what we do is we work with the nursing, allied health administration of the hospital to provide excellent medical care. I have to say, in a normal time, we're the only 4-star hospital in the vicinity. We're a very clean hospital. I'm very proud of the hospital and the type of medical care that we provide. Life goes on, or sickness unfortunately goes on too. I just want people to know that the hospital is very clean. Right now we still do not have, fortunately, anyone with COVID-19 in the hospital. That if somebody is sick and needs care, they can receive care at the hospital and get good care also. Of course, by the directive of the governor, we are limiting elective and non-essential procedures. That'll be reassessed April 6th. We don't know, honestly, will there be any lessening of that. Get with your doctor, your surgeon, to find out if this is something that really needs to be done now or it can wait. Of course, normally we are responsible for credentialing and doing things like that to make sure we have good doctors, good qualified doctors providing care, but these are not normal times. So what we've done is establish a COVID-19 response team. And probably the best thing I've ever done is to appoint our Vice Chief of Staff, Dr. Matt Hansard, to head that up, and he has spent multiple hours and hours working on this. So the hospital is prepared. We were involved in helping set up the clinic, the flu clinic, talking to the outside doctors, knowing what to do with patients that may be coming with symptoms, all the way into the ER, what to do with those, how to separate those patients from the normal patients so to protect both sides. And then when and if that happens, that we start admitting patients, separating them, putting them in clean places to keep them away from the rest of the medical staff. So I just want everybody to know that we are prepared. God willing, we're over-prepared, and we don't have to put a lot of these plans into place. We're prepared for worst case scenario, 30 to 40%. We don't want that, but we are prepared. That's the main thing we want people to know. So.
I have a 2-part question. How many people have been to the clinic since it's been open a week, and how many COVID tests have you performed at that clinic in the last week?
We see on average about 50 patients a day at the flu clinic, which is important because it also reflects about a 50% or 50 patient a day decrease in our ER volume. So it tells us that we are truly offloading some of those potentially infectious patients from the ER to an isolated clinic where they can all go through. In total, we've tested just south of 300 patients around the county through 300 patients. I say 300 patients around the county, most in outpatient settings. Some we've tested in the ED. We've had patients we've suspected in the hospital, but have all turned out to be negative. So we've not had to date a positive patient in the hospital inpatient setting. We continue to do everything we can to isolate these patients, keep them cohorted together and away from other patients.
So like you said, you guys are prepared for, let's say, 35 to 40% of people potentially getting this. What happens if it's more than that? How do you know if you have all of the PPEs in place, all of the correct gear to get through something that is worse than worst case scenario?
Well, I can say we spent multiple hours going through every possible scenario. I guess the worst worldwide is the Italy case, and we obviously don't want to see that. One, we don't have a population of Italy. We don't have the concentration of population. So really, the hospital is the last stand. It really, the front line is social distancing. It's make sure people are not congregating so they can spread the disease. If they do arrive to the hospital, what percentage of those are going to require hospitalization? What percentage are going to require ventilation? Ventilators, we're prepared for separating one part of the hospital for just be COVID-19 patients, one part of the hospital being so-called clean, away from COVID-19 patients. We're talking about separating ICUs. We have, I think, 15 ventilators? No.
We have 6 ventilators that we routinely use, and 5 we've got as backup.
So we have many ventilators. We have worst case scenarios. We can even put 2 on a ventilator. So we've thought through several things. Hope we never have to go to the worst case scenario, but we're thinking through it and we're preparing as best we can.
I would add to that, just being part of the Huntsville Hospital health system, a lot of the supplies, PPE, and equipment are warehoused across the system, but a lot of it in Huntsville. So the ability, because of these daily calls that we're having across the system, for the system to react to the needs of any pocket of activity that would need extra PPE, extra equipment, extra whatever, can be marshaled and brought to that local community. So we luckily don't have to have everything on site. We have as much as we can, but then we also have the availability of other resources within the system.
Can I ask one follow-up question on that? How many people, I guess, who had the coronavirus cases, 11 that you said in Limestone County, my question is, how long were they in the hospital for, and are there currently any in the hospital?
There are none in the hospital currently. And the first patient, there's some confusion about the numbers a little bit. We report out that we've had 8 as of midnight last night, 8 positive cases. If you look at the Alabama Department of Public Health site and look at their statistics for Limestone County, I checked a little while ago, it was 10, so maybe it's gone up to 11. But the difference is, and this happened in other counties as well, we've gotten some clarification on the fact that if a patient lives in Limestone County, goes and gets tested in another facility outside the county, that then belongs to Limestone County. All right, so there is some, probably 2 or 3 apparently, that are resident of Limestone County that went to other locations to be tested. But as of right now, we don't have any active, nor anybody of concern in the hospital.
Can you talk a little bit more about what the actual test is? Is it still a 1 to 3 day return on results?
Okay, so there's several different providers. The state obviously bears the brunt of most of the testing currently, and that involves us taking the tests locally and getting them to them. And it takes about 3 to 5 days, I guess, on average, window to get results from that. There has been an issue, like it's been discussed, availability of testing kits. That's why we don't just test everybody who wants to be tested, because we need to limit them, because there is currently a shortage. But since that time, over the past week or 2, several commercial labs have brought online some test kits and availability to do testing. One is located in Huntsville that promises a 24-hour turnaround. We try to limit those for inpatients and healthcare workers that we need to know quickly to make either clinical decisions for a patient or quarantining decisions related to an employee who works in a high-risk area, that kind of thing. And there's several other commercial labs that have come online. Another one we're looking at also has a 24-hour turnaround. So it's about finding as many resources and opportunities to get these tests turned around quickly, rather than just relying on one location.
Let me add also, the test itself, we're testing people from the community who have symptoms. So if somebody comes and happens to get tested, no matter what the turnaround time, 3 days, 4 days, 5 days, for that period of time, they have to assume that they're infected, and they have to isolate themselves. That's the bottom line. And as I said, it takes usually 5 to 8 days from the experience in China and Italy for a person, after they start getting symptoms, to get seriously ill. So, you know, by the time the test report comes back, usually we will know whether whether they're at risk for getting sick or not. And then the other thing is, being in Alabama and us being one of the last states to report positive COVID-19 patients, we're benefiting from the experience of the other states, and as the national effort to get ventilators, get masks, get testing, everything ramped up about 3 or 4 weeks ago when the tsunami hit New York. And so we're benefiting from that, and all of these things, especially with the private sector getting involved. Testing is available, people are in competition to try to provide equipment, and so I think we're better placed than the Northeast in terms of being able to fight what may be potentially ahead of us.
We're hearing a lot about, liquid building up in lungs and what lungs look like, during the coronavirus. Could you talk about that and, what researchers have been noticing about people's lungs and the severity of what this virus does to your body?
Okay. Once again, let me emphasize, 80% of the infections involve the upper airway. So it's not in the lungs. 20% will have their lower airways affected, which is the trachea, the bronchi, and then further down into the lungs, which are the alveoli. Alveoli are like little balloons, little sacs, where exchange of oxygen occurs between the blood and the air that we inhale. And what happens in this disease when they have done autopsies is the little septi, or the little membranes that separate one part of the lung from the other, those get wiped out. And so that's where the damage occurs. Dr. Fry over here is a radiologist. He can tell you 60 to 70% of the patients will show significant abnormalities on the CAT scan. You'll have a ground glass appearance when you look at the picture of a person who's seriously ill and their oxygen saturation drops, and we have to put them on mechanical ventilation and give the body time to recover. Surprisingly, a lot of this damage happens not so much from the virus itself, but from the body's defense mechanism. The body is trying to fight the infection, and sometimes this is what we call maladaptive defense mechanism. We have what we call a cytokine storm. The body releases its soldiers to fight the virus, and instead those soldiers start attacking our own body and start wiping out lung tissue and stuff. So that's the mechanism which is being advanced right now. Of course, we're still only 3 months into this infection, and all the scientific data is not in.
For you, doctor, you said that the storm is on its way. But last week we talked about how Limestone County has been taking extensive precautionary measures, doing the social distancing, stuff like that. Can you talk about how that's going to maybe calm the storm that is headed our way, or how it could potentially calm the storm?
Again, we're talking from a 3 months experience, and so, we cannot make any promises. All I can say is there's so many variables here, so many variables. We talked about some, the sense in the community, the fact that we closed schools early, the fact that the administrators over here closed places of gathering, churches and restaurants. Life changed. And then, of course, we have this unknown variable. It's 80 degrees today, and that may help. Okay, that may help. The virus, and then our own airways. When the temperature gets warmer and there's more humidity, they react in different ways. We're able to clear the virus from our airways better in warmer temperature. So there's so many variables, and it's hard to predict, but it's better to be prepared for the worst and then hope for the best.
Thank you.
I'd like to add to that is that the whole point of the social distancing is so we don't overwhelm the healthcare systems. That's what we're talking about, flattening the curve. The vast majority is going to be mild symptoms, even like a mild cold. And some even, Dr. Graham, don't know the percentage, are totally asymptomatic. So that you don't even know you're shedding viruses. That's one reason when you want to practice social distance. You don't know if your friend or your loved one has the virus, and you don't want to get it, not necessarily because you're going to get sick. If you're young, healthy, you're not going to get sick. You don't want to pass it on to someone elderly or with comorbidity, diabetes, lung disease, something like that. But the worst thing we want to do is to overwhelm the system. We have 10 ICU beds. David mentioned we have 6 ventilators, of which we could get 5 more. We don't want to overwhelm with all the patients coming at the same time. We could spread those out over periods of time. That's what we want. That's what we're talking about, flattening the curve.